Another common question is, what is treatment and what are the different levels of care? Addiction and mental health share several of the same levels. However, addiction does have detoxification, which is different than mental health. Detoxification specifically is utilized when someone is physically addicted to drugs and alcohol. Again, typically we do not see this level in mental health. After detoxification, you or your loved one will be transitioned into residential treatment. Residential treatment is an inpatient level of care that requires you or your loved one to program 6 hours a day. This is inclusive of one-on-one counseling as well as group therapy. Once you or your loved one are stabilized in a residential level of care, it's only natural to graduate and to step down into an outpatient. Outpatient is where you or your loved one learn to bring stressors, natural stressors, and to bring it back into that controlled environment, an environment in which you can process things. Ultimately, the goal is to be successful and to be able to integrate back out into society in a way that is healthy and balanced. After outpatient, the different levels do go down. There's 3 hours a day in IOP, and then there's the lowest level, which is considered outpatient or monitoring. Essentially, this is when someone is usually about 3 or 4 months sober or 3 months into their treatment process, and they're really starting to get back into life. They're starting to find meetings or thrive or find the community in which they feel connected to. Ultimately, following through with each level is extremely important for long-term success. We have found that if someone is in treatment up to 1 year, they have an 83% chance of reaching 5 years of success in their recovery programs. Thank you for joining us for our first video series here at the Red Songbird Foundation. This next year, our main mission is to truly bring outreach opportunities, education, and resources to your home. Addiction and mental health issues only continue to get worse. It is imperative now more than ever to be a part of the conversation, to be the change. To learn more, head to www.redsongbird.org.